I'm VJ Hamilton and welcome to the Autoimmune Reset, the place for you to learn how to thrive with autoimmune disease and feel empowered to take steps to transform your health to feel better than ever. You can start making changes today to improve your health. So with every episode, my mission is to share with you simple ways to up-level your diet and lifestyle with key learnings from my own journey reversing autoimmune disease and inspirational stories from those who have reset their autoimmune symptoms and are now thriving in life. I suffered from autoimmune disease for over 25 years and now I live symptom-free, and I wish the same for you as well. So thank you for being here and sharing this time with me. Now let's get started. Hello and welcome to today's episode of the Autoimmune Reset podcast. I'm your host VJ Hamilton. I'm a nutritionist, scientist and expert in autoimmune disease. And today I'm very excited to have Dr. Eric Osansky on the podcast. He is somebody who has been able to reverse symptoms of Graves' disease and hyperthyroidism. And not only that, he now works as a clinical nutritionist, a chiropractor and a certified functional medicine practitioner, helping people who have experiencing similar symptoms to what he had. And he has written 3 books. You have the book Natural Treatment Solutions for Hyperthyroidism and Graves' disease. You also have Hashimoto's Triggers, the Hyperthyroid Healing Diet, and you have an incredible podcast yourself called Save My Thyroid. So definitely check that out. So welcome, Eric. I'm so excited to have you here.
Thank you so much, VJ. I'm excited to be here.
Well, where I like to start when I have guests on the podcast is for you to share your story, because what really makes a difference, I think, when having an autoimmune condition and helping people who are in a similar position to what you were is your own story. So I just love to hear from you how you were diagnosed, what your symptoms were, and how you were able to reverse it yourself. And I'm sure that will feed into more of the conversation that we have on today's episode.
Yeah, so my journey began, I was diagnosed with hyperthyroidism in 2008, and I was just walking around a retail store and there was one of those automated blood pressure machines, and I took my blood pressure, which was fine, but my heart rate was 90 beats per minute, which was a little bit high. And I'm like, well, maybe it's because I'm walking around. So the next few days I took my resting heart rate at home, and it was anywhere between 90 and 110 beats per minute. And that's when I knew something was wrong, and ended up seeing just a primary care doctor at the time, got diagnosed with hyperthyroidism, and then a few months later was able to see an endocrinologist and got the official Graves' disease diagnosis. And in addition to like the tachycardia, the increased resting heart rate, I had palpitations, I lost a lot of weight, increased appetite, just looser stools. So we could definitely talk more about those symptoms, but I was my very first experience with Graves' disease, and ever since then I just realized how many people that are out there with the hyperthyroidism and Graves', and that's why I started working with other people just like me.
And what did you think when you were diagnosed? Had you come across it before? Had any of your family members had similar issues, or was it completely new to you at the time?
Yeah, it definitely was completely new. No family history of Graves' disease. Didn't work. I worked prior to that. My background's a doctor of chiropractic, so I just had a traditional chiropractic practice. And so, everybody comes across thyroid patients, but at least up until that time, I don't recall seeing, if I had a patient with Graves' disease, I certainly wasn't helping them with their Graves' disease condition. They just had it, and they were seeing me as a chiropractor. So I was my very first Graves' disease patient.
What did you do initially when you had the diagnosis?
So initially, honestly, when I first got diagnosed with hyperthyroidism, I didn't do anything. Let me backtrack. So prior to my diagnosis, whenever I took my continuing education credits as a chiropractor, I always took nutrition courses, functional medicine courses, and I did take a few functional endocrinology seminars. So when I was diagnosed with hyperthyroidism, I didn't know, I was my first experience with that, but I did know there were some solutions based on the seminars that I attended. So I did want to get the official Graves' disease diagnosis. And knowing what I know now, I could have done everything on my own, I guess, without going to an endocrinologist, because I only went to an endocrinologist that one time. I didn't go for continuing care. But anyway, I wanted to to be from an expert, that diagnosis. So I got the Graves' disease diagnosis, and then at that point, I knew I was going to at least take a natural treatment approach. I was recommended to take methimazole, which is a type of antithyroid medication. I decided to hold off on that and took the herbs bugleweed and motherwort. And bugleweed is an herb with antithyroid properties. And again, I didn't know if it would work, if they would work, but I figured I'd give them a try. And then if they didn't work, I could always take the antithyroid medication. But thankfully, they did help greatly in managing the symptoms. And then, I went on, of course, to do other things to improve my health, to incorporate the foundations, which we'll talk about, and do some testing as well.
Yeah.
But but I didn't follow any of the conventional medicine treatment. And one more thing I'll say is there's a time and place for that. So even though I didn't do it, I do have patients who take the antithyroid medication. But again, that was just my decision not to.
Okay. And I mean, I suppose people listening to the podcast might not have heard of Graves' disease before, because I think a lot of the time, and I've certainly covered it in this podcast on previous episodes, we're talking a lot about Hashimoto's and hypothyroidism, but rather than talking about hyperthyroidism and Graves' disease. So it's just interesting to understand the difference between the two, what you got tested for, how you discovered that you had. I know you mentioned your diagnosis, but what were they looking for in your blood? Because I think that's quite interesting for people to understand.
Yeah, great question. So with the thyroid panel, with Hashimoto's, you're looking for that so there's TSH, thyroid stimulating hormone, which is actually a pituitary hormone, and then there's the thyroid hormones T3, T4. There's also T1, T2, but they can't be measured as of now on a blood test. So with hypothyroidism, Hashimoto's, you have the thyroid hormone levels on the lower side. Sometimes they're overtly low, sometimes they're subclinically low, so they're within their range but less than optimal. And so when those thyroid hormones, when they're on the lower side, the pituitary gland communicates to the thyroid gland that, hey, we need some more thyroid hormones. So it's secreting more TSH, more of that thyroid stimulating hormone. So with Hashimoto's, typically you'll have higher TSH, lower thyroid hormones. With Graves', it's the opposite. You have too much thyroid hormone. So you'll see high levels of T4 and T3 on a blood test. And as a result, the pituitary gland is not secreting any TSH. And so you'll see low levels of TSH, many times undetectable levels of TSH. So it might be like less than 0.001, for example. And then with the antibodies, associated with Hashimoto's, we have thyroglobulin antibodies. And then we have TPO, or thyroid peroxidase antibodies. So if we have one or both of those antibodies in the presence of an elevated TSH, regardless of really what the thyroid hormones show. If you go to a medical doctor, you have elevated TSH, even though we know TSH is not the most important hormone, but if you see that TSH elevated, those antibodies, then pretty much someone will be diagnosed with Hashimoto's. With Graves', you have thyroid stimulating immunoglobulins, which is a type of TSH receptor antibody. And so if someone has hyperthyroidism and then they also test positive for those antibodies, then that is pretty much diagnostic of Graves'.
All right. And I suppose since your diagnosis, I mean, it sounds like you've done a lot to improve your health. And I mean, how long was it until you got retested to see that everything had stabilized?
Yeah, well, I mean, I did test along the way. So I did every couple of months. I mean, I usually recommend retesting like every 6 to 8 weeks. And so that was kind of what I was doing. And it took about 9 months until the point where I was able to get off of the bugleweed. And then even after that, I wasn't sure if my numbers would be looking good after that. And so, but thankfully they did. So I did a few blood tests after that and they looked good. So eventually I just went further out with between the testing.
And so some of the symptoms that you mentioned, like the fast heart rate, the loose stool, how does that link to hyperthyroidism? What's the link there? Because I suppose people listening might not realize that the thyroid hormones are controlling a lot of these systems in our body.
Yeah, great question. So, I mean, thyroid hormone affects every single cell and tissue in the body. So you mentioned you've spoken a lot about Hashimoto's. So many of your listeners probably realize that with hypothyroidism, Hashimoto's, typically you have the lower metabolism, and that leads to like fatigue and weight gain and other types of symptoms, coldness. And so with with hyperthyroidism, it's the opposite. You have that, since you have a lot of thyroid hormone in the bloodstream, you're going to get that increased resting heart rate. You're going to get that increased the palpitations. You're going to get heat intolerance instead of the coldness. So sometimes it might feel like you have hot flashes. That could be, again, related in this case to the thyroid. With hypothyroidism, since everything's slow, again, you're more likely to have constipation. But with Graves, you get that increased thyroid hormone, so you get increased motility, increased transit time. So you're going to get, in many cases, loose stool, sometimes diarrhea. There are many other symptoms like hair loss, which is common for both hypo and hyper, but a lot of people it's really extreme where they're losing a lot of hair. Again, that increase in thyroid hormone a lot of times will make people more anxious, a lot of times cause insomnia.
Okay, and so with Graves' disease or hyperthyroidism, what do you feel? Do you feel that there are some misconceptions about it? Because, as I said, a lot of us, when we're thinking about thyroid issues, are thinking more about Hashimoto's.
Yeah, well, one misconception that's the same with Hashimoto's is that a lot of people think of it more as a thyroid condition rather than an immune system condition. And a big reason for this is because most medical doctors treat it as thyroid condition. So with Hashimoto's, as you know, they usually would just give synthetic T, and that's the solution for Hashimoto's. With Graves, it's a little bit different. Usually they'll either give antithyroid medication, radioactive iodine, or thyroid surgery. So there's 3 options, and all 3 of those options focus on the thyroid gland. So none of those options are doing anything for the immune system. So that's probably the biggest misconception.
It is. That's such a great one as well. I see it time and time again with clients who will get diagnosed with Hashimoto's or hypothyroidism in their 20s. They just get given a medication. They're on the medication for 15 years, and then they develop another autoimmune disease because the immune issue hasn't been dealt with, even though their thyroid condition is being managed to a certain extent. So that's such a great point. And that leads me to, obviously, you're helping lots of people and you've written books helping people who have these conditions. So what are the main things you're looking for as a root cause when it comes to these conditions?
Yeah, so there's different triggers. And again, this applies for really both Graves and Hashimoto's. So, diet could play a role, food could play a role. We know that gluten can be an issue with both autoimmune thyroid conditions as well as other autoimmune conditions. So just having people avoid the common allergens such as gluten. I will say stress is huge. Stress in my case was a big factor, and it wasn't just the emotional stressors, but the physical stressors. I was overtraining prior to my Graves' disease diagnosis, so I'm sure that was a factor. So the foundations are important. So diet, stress management, getting proper sleep, of course, regular movement, but like I just mentioned, you don't want to overdo it. Gut health is important. Most of the immune system cells are located in the gut, so you need a healthy gut to have a healthy immune system with both Graves and Hashimoto's. And our toxic burdens are higher than ever just because of all the environmental toxins and toxicants out there. So doing things to reduce our toxic load. And again, a big problem is, even though the focus here is on Graves, a lot of these chemicals are also thyroid disrupting chemicals too, endocrine disrupting chemicals. So some of them will not only impact the immune system and the gut, but also directly will affect the thyroid, usually causing more hypo than hyper because of its disrupting properties. But I guess the point is we want to do everything we can to reduce our toxic burden. And there are so many different... The challenge with these autoimmune conditions, again, Graves and Hashimoto's, is that there's not just one thing. It's not like celiac disease where you avoid gluten and then that will take care of the autoimmune response. Here, someone could eat a great diet and maybe even following like an autoimmune paleo type diet. And in some cases that could do wonders, but then in other people, it's still not doing much. And then we have to look elsewhere. But that's also why we don't want to just do diet. Usually we need to do things beyond diet and lifestyle.
Yeah, I completely agree. And I know you mentioned that stress was a factor for you. And again, people might be wondering, and I talk a lot about stress management and stress resilience as well. But could Could you explain a little bit more about the link between hyperthyroidism and, being chronically stressed or being depleted, or, how does that tie in? People might not understand the link between the two and how that helps you as well, because it sounds like that was quite a big factor for you developing Graves' disease. It sounds like you were doing a lot before you developed Graves' disease.
Yeah, stress, it dysregulates the immune system, causes an increase in pro-inflammatory cytokines, which are factors in autoimmunity. Also decreases what's called secretory IgA, that lines the mucosal surfaces of the body, including the gastrointestinal tract. So that also could set the stage for a leaky gut. That increase in intestinal permeability, which is a factor in autoimmune conditions such as Graves' and Hashimoto's. So those are, two big ways that stress can affecting more of the immune system. It could also, as you know, affect the thyroid, can affect conversion of T4 to T3, which is more of not so much of an issue with Graves as it is with other thyroid conditions, but that dysregulation of that immune system, as well as the impact that it has on the gut, are two of the biggest factors when it comes to being at least a contributing factor in the development of Graves.
Have you ever worked with anybody where, say, Graves is almost secondary to another autoimmune condition? I know, for example, there are certain medications that can stimulate Graves' disease. Have you ever come across that in your clinical practice, or is that not something that you work with?
Where someone had another autoimmune condition that was more predominant, you mean, or?
Yeah, I've come across it before, and if you haven't come across it, that's absolutely fine. But where, for example, somebody with multiple sclerosis might take medication for that and then end up, as a result of the medication, having an issue with Graves' disease. And I just wondered what your process was around that, if you'd ever come across it before.
Just like I'm sure, yeah, we both have worked with people, like if someone has one autoimmune condition, they're more likely to have another one. And so, yeah, without question, I have worked with, to answer your question, so I have worked with people who had not just Graves, but other autoimmune conditions. Usually when they're coming to see me, usually the Graves is the more dominant condition. So that's what they're usually clearly hyperthyroid. Now, whether or not that was caused by, like you said, like them treating a different autoimmune condition, that I'm not sure. I don't recall.
Okay.
But it is common to have multiple autoantibodies for different autoimmune conditions.
And it is with Graves as well. I feel like it's quite a quick onset, isn't it? And it's something that needs to be addressed quite quickly in comparison to some of the, I work a lot with alopecia, and that could be pretty quick as well for some people. But other autoimmune diseases are kind of there, and people are living with the kind of more chronic symptoms, but it's manageable. Whereas I think with Graves, you have to address it quite quickly, don't you? Because some of the symptoms can be quite scary, like the fast heart rate and some of the other symptoms that you get with it.
Yeah. You're right.
You're always working with that predominantly?
Yes. You are right. Like like with Hashimoto's, it could kind of linger for a while. And part of it is because when people experience some of the symptoms, they might attribute it to other things. If they're gaining weight or getting fatigued, maybe they just think, oh, I'm working too hard or not getting enough sleep or don't have a perfect diet. But with Graves, you're right. When someone has same thing, that's what happened to me. I took my heart rate. I'm like, wait, 90 beats per minute, which isn't extremely high, but still it's pretty high. But then when I noticed it went up to anywhere, like up to 110 beats per minute. I've worked with people where it was 150 beats per minute. But even, once you get, especially in the triple digits, it's hard to ignore that. And then you feel the palpitations and other symptoms. So yeah, you're right. It's something that's very noticeable, and usually people are quicker to take action. And you're also right in that you want to do things quickly to take action. Like if someone has a resting heart rate in triple digits, you definitely want to get that under control. You don't want to let it go for a few months unmanaged.
Yeah, I completely agree. Yeah, I've seen people with high heart rates, and that's when it needs to be addressed pretty quickly. I suppose, you've worked with hundreds, maybe thousands of clients with this condition. What's your typical framework? And I know it's quite difficult because everybody has different triggers and underlying contributing factors, but how would you approach working with somebody if they came to you and they'd just been diagnosed with Graves' disease?
Yeah, so what we just mentioned, first, like safe symptom management is important, just because, as we just discussed, if someone has a resting heart rate that's over 100 or even, again, in the 90s, we want to get that under control. And then I mean, it also affects bone density. So let's say if someone has hyperthyroidism, and I mean, there's rare cases, but every now and then someone will be hyper, but their heart rate will be okay. Like it won't be elevated, but it's still affecting the bone density potentially, even if you're not symptomatic, even if your symptoms are more subclinical. But so safe symptom management. And if someone is, or most people who see me, they've already been diagnosed by an endocrinologist prior to seeing me. So a lot of people are already taking a methimazole, or in the UK, I believe it's carbimazole, which converts to methimazole. And so if they're taking it and if they're tolerating it okay, like again, I'm fine with them taking it. I'm not going to try to talk them out of taking it. If they're having negative reactions, then, I mean, they might ask me, is there alternatives? And then we'll talk about bugleweed. But either way, whether it's antithyroid medication, whether it's herbs such as bugleweed or motherwort, again, you want to be safe with the symptoms. And then incorporating the foundations that I mentioned earlier. So, I mean, everybody, we want to make sure they're eating a whole healthy foods diet, and there's no diet that fits everyone perfectly. I mean, some people follow like an autoimmune paleo diet, some people follow like a regular paleo diet, some others maybe like a more modified paleo diet. But what these have in common is, again, whole healthy foods, avoiding refined foods and sugars, avoiding fast food, and again, stress management's important, as we mentioned. So blocking out time for stress management on a daily basis is what I recommend. Trying to get sufficient sleep, which a lot of times is a work in progress. And then doing testing. I do like to do testing to try to find out what potential triggers may have. And the testing does depend on the person. I mean, I like adrenal tests. I know some people like to just assume that we have adrenal issues. And I mean, I think it's safe to say most people do have adrenal issues. I just like to look at either a saliva test or a dried urine test like the Dutch test and look at the circadian rhythm of cortisol. Some people, we do, as I believe you do, comprehensive stool testing to see what's going on, things like GI effects, GI map, and organic acids testing in some people, mold testing or mycotoxins testing, SIBO testing. Again, we don't do these in everybody. It really depends on the person's health history, but that would be really the next step, trying to find the triggers. And also blood testing, I didn't mention, goes without saying, do testing for iron panel, vitamin D, B12, things like that. And then once we get the results, give specific recommendations based on the findings. And yeah, those are really the things with everybody that I'm going to recommend. Safe symptom management, foundations, and then functional medicine testing.
Okay, you mentioned the gut quite a few times, and I know your newsletter is Healthy Gut, Healthy Thyroid. So why is that so important when it comes to this type of condition? And what are you looking for when you're doing the testing? And what normally comes up with most of your clients? Well, not with most, but when you're doing the testing, what comes up for those clients?
Yeah, so the reason it's important, so I mentioned earlier that most of the immune system cells are located in the gastrointestinal tract, so you need to have healthy gut in order to have a healthy immune system. And then there's also the triad of autoimmunity, also known as the three-legged stool of autoimmunity. And that says that there are three components necessary for autoimmunity to develop: a genetic predisposition, exposure to one or more environmental triggers, and that third component, that increase in intestinal permeability or that leaky gut. And so if you don't have a healthy gut, really difficult, if not impossible, to have a healthy immune system. And so that's why having a healthy gut is important for anybody with Graves or Hashimoto's for that matter. And with the testing, I mean, like I said, I do a decent amount of stool tests, but sometimes it's not what we find in a stool test. Sometimes avoiding gluten, as we know, gluten can cause a leaky gut. So just cutting that out in some people can make a big difference. But like I said, some people, even if they're following a AIP type diet, we might need to dig deeper. And so the stool test, we're looking at things like H. pylori is a very common finding, and there's even a literature relationship between H. pylori and Graves as well as Hashimoto's. Another one in the literature that I can't say I see a lot on a stool test, but Yersinia enterocolytica, there's a relationship between Graves and Hashimoto's. And then parasites, of course, can be a potential factor. Again, they're not perfect, the stool tests for parasites, but if they show up, again, I usually do address them. And then we'll see other markers. A lot of people have low pancreatic elastase, secretory IgA. I mentioned, which most comprehensive stool tests at least will look at many times. That's low. And then it depends. Sometimes we'll see like high calprotectin, which I can't say is the norm in people with Graves. So if someone's having that, maybe we're thinking there's something else and not necessarily just related to the Graves. Candida. Yeah, yeast overgrowth. Again, not the stool test, at least in my opinion, is not the best test for looking at Candida. But if we do see it on the stool test, then we know that's most likely impacting the gut as well.
So what's your, just on that subject, because I see it come up in my clinic as well. So what test do you like around Candida then? Because I see Candida sometimes as just opportunistic, or it can be the root for some people, but it can be there because there are these other imbalances going on. As I know, we think the same way, but the immune system is likely suppressed, and that's probably more of a cause than the Candida itself. But what other testing do you like around that?
Yeah, and that's a good point. I mean, just because you have something show up doesn't mean that it's the main cause, not just Candida, but you might see like streptococcus or these other things, which are more incidental findings, opportunistic. Maybe it's just a low stomach acid problem, for example, and you have to focus on that. But when I do test for Candida, I mean, sometimes we know even without testing, like if someone has strong sweet cravings, a thick white coating in the tongue, maybe gastrointestinal symptoms, but even if they're not having GI symptoms, but that thick white coating, sweet cravings, then we might be suspecting Candida. Again, organic acids testing, I think, in my experience at least, seems to be the most accurate. The good thing about organic acids testing is not just looking at Candida, but other types of yeast as well. Also looks at some mold markers. I mean, I do sometimes the antibodies for Candida. I can't say that's my number one test I would look at. But again, I learned from having Dr. Ami Kapadia on the podcast, and she spoke about testing the blood markers for Candida. So I'm like, you know what? I'm going to start doing that, because not everybody's going to do the organic acids test, because it is a pricey test, even though it's a good test. And I mean, depending on what that shows, that might give us some information as well, those blood markers.
Yeah, they just give you that insight and help you build a picture, don't they, for the person? So, I find them a great tool as well. But so if somebody is doing all the foundational pieces, they are working on their stress management, and they seem more resilient in that regard. They're eating the right diet. They've taken out those inflammatory foods. They've been working on their gut, but they're still not seeing progress. What type of nutrients are you using for these clients? And I know it's probably very personalized, but what do you see working the most? And maybe you can share a bit more about your story and your recovery as well as part of that.
Yeah, I mean, you are right that it's personalized, but also there are nutrients that most people need. So I've heard on your podcast talk about selenium, which, a lot of research with selenium and TPO antibodies, and also in Graves' disease and thyroid eye disease, which I didn't mention thyroid eye disease. Also, a lot of people with Graves have thyroid eye disease, and which is also an immune system condition. But selenium, very helpful. Omega-3 fatty acids, I need to mention something. And again, this is something I still take to this day, just because I know I don't eat enough fish. And if someone's not eating fish at least a few times per week, and they're not supplementing with an omega-3 fatty acid like a fish oil, then chances are, at least again, I find through testing, that they're usually deficient. They usually have that low omega-3 index. And so omegas are important. Vitamin D, I know it's more of a pro-hormone than a true vitamin, but still most people, if they're not supplementing, or in some cases maybe getting enough sun exposure, but a lot of people aren't doing that either. So a lot of people are deficient in vitamin D, which is important for having a healthy immune system. So those are like three of the big ones. Now, there are so many other important, all the nutrients are important. Magnesium is important, zinc's important, and of course you can, test for these as well. The B vitamins, especially when someone is dealing with adrenal issues, which describes a lot of people with Graves' disease. So, again, I took a B complex as well when dealing with, and from a nutrient standpoint, again, they're all important, but those are some of the more important ones. Vitamin A, I should mention also, doesn't get talked enough about, but vitamin A is important for a healthy immune system.
Yeah, they're some of the ones that I see people are quite depleted in as well. And even things like vitamin A, People just think about the orange coloured fruits and vegetables, but actually if you can't convert it into its active form, then that can be an issue as well. So there is a bit more nuance to it, unfortunately. But yeah, these are some great ones to recommend. And I suppose, we're coming to the end now, but when you're thinking about thyroid issues from a healthcare perspective, or any of like the most current research, what are you hopeful about at the moment when it comes to these conditions?
Well, I mean, I'm hopeful that there is more awareness now. I mean, they're definitely more common. I mean, we're seeing more people with Graves and Hashimoto's these days, which is not good. But there's also greater awareness now out there because of the research and because of podcasts like yours and mine spreading the word that there is hope out there. So yeah, I think just people being aware and realizing that there is hope, that there's more out there than just taking thyroid hormone replacement in the case of Hashimoto's and antithyroid medication or radioactive iodine in the case of Graves.
And how do you feel, I mean, from a personal perspective, are you hopeful? I mean, you've been in what we call remission for such a long time now. Have you ever had any flares or any other autoimmune type symptoms, or do you feel like you're in a strong position now and using the principles of functional medicine to kind of maintain a certain level of health?
I haven't had any flares with Graves. I've had some scares along the way. I was diagnosed with chronic Lyme disease and Bartonella in 2018. Oh, no. And so when I had that diagnosis, I was worried that maybe they would re-trigger Graves or maybe trigger Hashimoto, another type of autoimmune condition. Thankfully, it didn't, and I got that under control. And then I did get hit hard with COVID in 2022, and I thought I relapsed because I was having a tachycardia, and it's hard because viruses can cause that too. So I wasn't sure. So I didn't know, was it the virus? Was it Graves? Was it subacute thyroiditis? I mean, then after, it took me a few weeks. Again, I had COVID pneumonia, which I never get sick. I never get like the flu or anything. Like I get some mild colds every now and then, but nothing any bad. So I was like surprised that it hit me as hard as I did. And so it took me a few weeks to recover. And then after that, I waited a few more weeks before doing a blood test, just because I wanted to do a blood test when I felt good and not be influenced by the virus. And when I did the blood test, my thyroid looked good, my antibodies looked good. Now my C-reactive protein was still through the roof, my CRP was high, and then I tested 3 months later, my thyroid still looked good, but my CRP was still high after 3 months. So the inflammation after the COVID pneumonia lasted a while, and then 3 months later I retested and the CRP finally dropped down to normal. But thankfully, my thyroid, I don't know how, but I guess because I was doing other things right. But yeah, I was able to avoid. So yeah, to answer your question, thankfully, no flare-ups, getting into remission back in 2009. But I have had a few other scares that I thought might lead to a relapse or some flare-ups.
I think this is such a key point, though. It's you had, I mean, those infections, obviously, you got hit hard by them, but the truth is, because your foundation was already very stable, even though you got ill, you were able to recover without a flare. And that's what I always say to my clients. It's about getting to a point in your health where you are going to get ill, you are going to go through stress, you might lose people, these things happen in your life, but if you build a solid foundation, hopefully you can get through them without a flare. And that's how I always see it. So when something happens to me, and I got the flu really badly in December, I never really get ill either, but the flu really hit me hard, and I'm always a bit worried, like and with alopecia it's like counting 3 months as well. But I think once you've got that, you feel a bit more robust, you're working on the stress management piece, making sure you're eating the right foods. It helps so much, doesn't it, in the long run?
It does. I mean, that's that's big. Just even with the Lyme, when I dealt with chronic Lyme, it wasn't as bad as it could have been. And I think the reason is because that was in 2018, so that was 10 years after my Graves' disease diagnosis. So I was definitely, maybe I wasn't perfect, but nobody's perfect. And I was still doing a lot from a diet perspective, better with stress, better with sleep, doing sauna therapy, which I still do these days, a few days a week. So yeah, I like to think because I was taking better care of my health, it wasn't as bad. And same thing with the COVID pneumonia. Even though it hit me hard, I was able to avoid getting hospitalized, and it could have been worse maybe if I wasn't taking care of my health up until then.
Yeah. And I think you make another good point that you don't have to be perfect. It's just about, it's just about maintaining a certain level. And I just don't want people to listen to this and think you have to be perfect, because I'm certainly not now. And actually, I've got more tolerance to things, so it makes it a bit easier. And you just work out where the balance is.
Agreed.
I always think when people are listening to this podcast, especially when we're talking about a key autoimmune condition, what would be your advice to somebody if they're listening to this, they've just been diagnosed with Graves' disease? What would you recommend doing as their first action? Obviously, coming and finding you and reading your books and signing up to your newsletter. But would you give anybody any advice if they've just been diagnosed with Graves'?
Yeah, keep an open mind, because chances are your endocrinologist won't have an open mind. And so when you go through that very first doctor's appointment, and again, in most cases it will be maybe starting off with a primary care doctor, eventually endocrinologist, chances are both of them won't be open to natural approaches. They'll just tell you that there's no cure for Graves' disease. And so it could be very demoralizing and very scary to hear an endocrinologist mention things like radioactive iodine and thyroid surgery and tell you those might be the best options. It's like I said, I went to an endocrinologist, and and a lot of my patients go to endocrinologists, if not most of them. But just again, make sure you keep that open mind and realize that your autoimmune condition, your Graves' disease condition, developed for a reason, and it wasn't because of a deficiency in anti-thyroid medication, and you have a thyroid gland for a reason. So of course I'm going to be biased, but I would say to try everything you can do to preserve the health of your thyroid gland, to save your thyroid gland.
Yeah, completely agree. That's great advice. So where can everybody find you if they want to, hear a bit more about what you do? I know you've got your podcast as well. What's the best place for people to find all your resources?
Yeah, my podcast, as you mentioned, SaveMyThyroid.com, and or you could just visit your favorite podcast platform and just type in Save My Thyroid. And then, you mentioned the 3 books earlier. I have 2 on hyperthyroidism, 1 on Hashimoto's, which you could check out by visiting Amazon. And then my newsletter, Healthy Gut, Healthy Thyroid, which you could check out by visiting SaveMyThyroid.com/newsletter.
Great. Oh, well, thanks so much for being on the podcast today. I think this has been such an insightful conversation. If anybody has any questions, then feel free to pop over to my Instagram account, which is at the Autoimmunity Nutritionist, or you can contact Eric himself and ask us any questions if you've got any following this episode. If not, lovely to speak to you, Eric. I'm sure we'll catch up again soon.
Yeah, again, thank you so much, VJ. Really do appreciate this, and I really enjoy this conversation.
Great. Thanks for being here. Take care. Thank you very much for joining me today on the Autoimmune Reset. I really hope you enjoyed the discussion, and be sure to subscribe to the podcast so that you never miss an episode. And if you liked it, I would hugely appreciate a review on iTunes, as it helps me understand what you like about the podcast and to help share the information with more people. I'm excited to speak to you next time. And remember, you have the power to take the reins on your health. So keep the faith and celebrate the small wins. Until next time.